More than half of physicians are experiencing burnout from this ridiculous rate of having to see patients every 13 minutes. But the thing about healthcare, right, and the problem with healthcare, right, is this is a system wide failure that is due to the biggest aspect when it comes to just healthcare, which is everything is this fragmented piece that does not coalesce and go together. Fractured foundation that medicine sits upon that is always historically sat upon that's added to the detriment of our patients, but more importantly our healthcare system. You know what the real crisis in American healthcare is? And it's not the rising cost, which is bad. It's not all this administrative hoopla and paperwork, which is also bad. But it is one problem that a lot of people don't name, but it costs a lot of people lives. I'm Dr. Barry Pierre, board certified internist, host of Medicine Mondays, and today, right, we're going to talk about the real reason why we're stuck in this healthcare hamster wheel and what you and your loved ones can actually do about it. All right, so this is some data that I want people to kind of get, right, so you can kind of understand where we're headed. Average time for a visit is about 13 minutes, right? 13 minutes for an office visit. Burnout rate for physicians is 63%, right? According to that a few years ago. Probably around the same number, if not higher now, right? So 60%, more than half of physicians are experiencing burnout from this ridiculous rate of having to see patients every 13 minutes. And 13 minutes, if you talk to some patients, is very generous, right? There's a lot of people who spend more time going to the doctor's office, finding a parking spot, sitting within that lobby than they do when it's time to get their name called, go in the back, see the doctor, and then head on out, right? Most people are spending much more time in the process of going to the doctor, sitting in their office, waiting for the doctor, getting some vitals, going to the back room, waiting for the doctor to walk in, than they are actually spending time with the doctor. I want y'all to think about that. I want y'all to think about how that scenario is so wild to understand. And if you're thinking that the cost of healthcare is the thing, you'd be right. Like, that's part of it. You think this administrative burden is the thing? Yeah, you'd be right. But the thing about healthcare, right, and the problem with healthcare, right, is this is a system-wide failure that is due to the biggest aspect when it comes to just healthcare, which is everything is this fragmented piece that does not coalesce and go together. Like, there's a couple pieces here, a couple pieces there, but when it comes together, it doesn't make one solid piece, right? And it's that fractured foundation that medicine sits upon that is always historically sat upon that's added to the detriment of our patients, but more importantly our healthcare system. I think the biggest thing and biggest example that I always like to pull from is when I think about patients, especially patients with chronic diseases who have to see quite a few specialists, right? You may have one patient who has to see a cardiologist, who has to see an endocrinologist, right, who has to see their OB-GYN, right, and another specialist. Maybe they've got their colonoscopy. Like, they see all these doctors, right, and then they have this one primary care doctor. In an ideal world, the primary care doctor would know what every other doctor is talking about, which is cool in a good rate. But think about this, right? Like, if I'm the primary care doctor, I should know of what's happening with all of these different specialists. What if I'm the specialist? What if I'm one of the specialists? I'm the cardiologist, and I kind of need to know what the endocrinologist is talking about. I don't really have a good way or system to talk about that. I just know that on some days I go see the heart doctor, and other days I go see my diabetic doctor, right? And that is a reality for a lot of people. That is reality for a lot of people because that kind of goes back to what we kind of mentioned in the last segment. where you have this sped up time that has to occur because there's so many people who need to be seen. Because there's so many people who need to be seen, one doctor isn't going to be able to manage, the heart attack issues, the diabetes issues. More importantly, they may not want to. They may figure the ROI of telling you to go find another doctor, go take care of that is much more than them actually trying to figure out how to do it themselves and squeeze you in to their appointment. Right? Like, think about that, right? That is the problem at hand when we think about, just this, how broken up this healthcare system is, right? Again, before we get ahead of ourselves, make sure you hit that like and that subscribe button, notification bell at the top, so you're always aware of what's going on, within the world of Medicine Mondays and a new series that we got coming out. I'm gonna keep the wrap on that, hush on that, but it's there's a book right here that it kind of the foundation of it. So let's talk about the issues that I have at hand, but more importantly, we're going to talk about some strategies that we can kind of do to try to get over the hump, right? Because there's no point for me to tell you the problem and not at least give you some solutions that I think you'll be able to kind of help manage and work on today. No point for me to do that. So number one, make sure you're writing this down. Demand a primary care quarterback, right? And this is where I kind of mentioned the ideal world. And in ideal world, when I was doing outpatient medicine, all of the specialists always had to send me their notes. In fact, we had a system that if we didn't get a note from one of the specialists after a week, we'd request a note. Say, hey, my patient went to go see you. We don't have a note yet. Like, send that over, right? We made it a point. That was just a system that we had, right? Shout out to my manager, right? System that we had to make sure that was the case. Number two, use your patient portal. I've talked about this before. I think it's so underutilized, the amount of people who don't use a patient portal. Use your patient portal because you want to know what information is going on, what information is being talked about, what information is being said, what labs. You want to know what things are happening, especially like if you go to another specialist and they're like, what medication you take? Oh, let me go check. I'm taking this, and here, right? Use your patient portal. We already talked about, we always say bringing that special, healthcare advocate for you, extremely important. I think a big thing is, and this is what we kind of mentioned as far as with the patient portal, knowing what meds you're taking. That sounds self-explanatory, but you'd be surprised how many people don't realize how many medications they're taking, and not the medications that your primary prescribes you, right? Because, which is good if you're seeing your primary, but let's say if you're seeing a cardiologist, you're seeing a gastroenterologist, you're seeing the endocrinologist, you're seeing all these other specialists, they kind of need to know what medication you're on as well too, right? Because one medication that you take for the endocrinologist may be bad that you take for the cardiologist, right? So it's good to understand that level of importance, right? And you can't do that without your medication list, right? And again, if those kind of tips helped out, hit the like button for me. So what will social media do, right? Social media does some good things, right? But they do a lot of bad things too. They do a lot of bad things, right? When I think about social media and, when they try to think about their reasons why, like, this healthcare system is broken, right? It's always this aspect of selfishness in that, oh my God, the doctor is so selfish, or the doctor's not compassionate. They don't care about my time. It's always kind of wrapped in this blame game instead of blaming the system at hand, right? So they blame, usually doctors or nurses. They usually blame somebody to say why something isn't going according to plan. And that happens with patients too. Patients will kind of internalize that. They see something online. They see that. It says, oh, if your doctor doesn't call you 10 times a day, your doctor doesn't love you, right? Go find a new doctor. Then they go find a new doctor only to realize that doctor also does not call them 100 times a day as well too, right? Just craziness. And understand, I think communication is so key when it comes to your healthcare. I have patients who will carry a journal right? And that's something I like, the journal, especially if you're not a big techie person, who would carry a journal and say, hey, this is my primary, this is my specialist, these are the meds I'm taking. It doesn't have to be this extensive journal. It just has to be something that you should be able to reference pretty quickly for, a specialist or someone when you need to get done, right? So understand, documentation and everything, having that journal is, so important, because it allows you sometimes to be able to get away with not having that advocate, right? Because sometimes I may not have an advocate, right? Sometimes I may not have someone who can, go to the doctor with me. But if I got that trusty envelope, right? If I got my trusty notebook ready to write, and your doctors shouldn't have a problem with you documenting what's going on, right? In fact, they should probably encourage you, right? And they may say, hey, check out the patient portal. Patient portal has a lot of these things there. But sometimes it's just easier to write it down because you just want that muscle memory. And if you change a medication, you can kind of document why you're changing it. So it's important to see when we think about healthcare and we think about communication and we think about how fragmented it is, that there are ways to connect it together. So it's not they're fragmented forever and they'll never come together. No, it's just understanding that there are gaps that you as a patient is likely going to have to fill, right? And whether it's making sure you're getting on your primary and say, hey, did you get the note from the cardiologist? Did you get the note from the gastroenterologist? Did you get a lot of times if it's just pressing upon that, like that is one thing that we need to make sure we hone in on, right? Like, cause in this day and age, especially, and me, I like tech, I like AI. We have all these new technologies that will one day, I think, I don't know how soon, especially with, when we talk about fragmentation, I don't know if you guys realize just how many different electronic medical records there are. Just how many different, like I round at 4 different spots, and three of them use different electronic medical records, meaning that I have to at least be able to know and understand how to use 3 different medical records whenever I work at a different facility. I got to know, like, okay, in this medical record, this is how I write to note. In that medical record, that's how I write to note. In this medical record, this is how I write to note. And even the ones that are same, there are certain things that I can do on one that I can't do on other, right? Mind you, same program, but I guess someone, paid for a little bit of upgrade, so I can do a couple things on one thing that I cannot do on the other, right? That's a problem. Like, that is a problem that we just got to address, right? And I think we will. So, and I like this. This is more of a nice little conclusion before we get out of here. I think especially in our healthcare system. I'm in America, right? So in our healthcare system, and I see this all the time. I usually see it social media. I'll see a social media post where someone has gone to like Turkey or someone has gone to, like China, and they've gotten the full workup done. And it costs, a tenth at what it would have cost to get here. And I say, man, I'm jealous, y'all, because there are some parts of the country who do reside in a world where, people and their system is talking to each other, is making sure that, like, if I do for you, I do for me. If I'm doing this over here, I'm doing that over there, right? Whatever the cardiologist orders, the gastroenterologist knows. Whatever the gastroenterologist orders from a testing standpoint, guess what? The pulmonologist knows, right? Like, all of these things just kind of talk together because that's how it should be. That's exactly how it should be, right? That shouldn't be a far-fetched scene. You shouldn't have to be a primary who has to track down all of the notes from specialists. They should be automatically sent it to, but they don't. So you kind of have to make do with, what's at hand. So before I get out of here, right? I just want us to understand that our healthcare is a personal responsibility. I say this all the time. You have to be aggressive when it comes to taking care of yourself in this healthcare system. Because if this healthcare system was so amazing, so great, you know what? They'd probably have to drag you to your next appointment because like, all right, I just got my screening. I just like, why do I got to get it again? Right. It would be that good. It's not that good. It is not that good. And once we understand that, the pieces are broken, but they're not forever lost, we understand what we need to do to kind of get them where they need to get to. Right. So again, I'm yours truly, Dr. Barry Pierre. You guys stay blessed. Have a great evening.